So, welcome to this session on wrist joint, also called as the radiocarpal joint. The reason it is called as radiocarpal joint because the ulnar joint, ulnar bone does not take participation in the wrist joint. Ulnar bone is a main bone participating in elbow, while radius is the main bone participating in the wrist. We always start with type of joint. This is a biaxial. This is a biaxial synovial joint, okay, of ellipsoid variety. Okay, it's of ellipsoid variety. It's a biaxial synovial joint of ellipsoid variety. Then comes the next point. What are the articulating surfaces? The articulating surfaces are the lower end of the radius. The lower end of the radius. This is the styloid process. So this is the lateral side. This is the styloid process of the radius, and this is the lower articulating surface of the radius, which is the one of the articulating surfaces. Then on the side, we know that is ulna. But starting from radius and going covering the surface of the ulna is the articular disc of the inferior radio-ulnar joint. So the first articulating surface is the inferior surface of the lower end of radius. Inferior surface of lower end of radius. And the second articulating surface. Now this we are talking about the upper articulating surfaces, which are formed by two things. And second is formed by the articular disc of the inferior radio-ulnar joint. Of the inferior radio-ulnar joint. Okay. Now what forms the lower articulating surfaces? Upper are formed by these two, and lower are formed by the scaphoid. Okay. Lower are formed by scaphoid. Then there is lunate, and then there is triquetral. Scaphoid, lunate, and triquetral. They form the lower. Scaphoid, lunate, and triquetral. After that, we move on to the ligaments. What are the various ligaments? So in the ligaments, first comes the capsule. Capsule is attached to the lower ends of radius and ulna, and they are attached to the first line of the carpal bones. Okay, they are attached to the proximal row of carpal bone, that is scaphoid, lunate, triquetral, and slightly to the principal. Then two. Then we talk about, of course, there is a slight recess in the capsule, which is called as a pre-styloid recess. Okay, now we talk about the other ligaments. Then firstly, there is a ligament called as palmar radiocarpal ligament. Palmar radiocarpal ligament. Okay, this palmar radiocarpal ligament starts from the styloid process and lower end of the radius, and this palmar radiocarpal ligament is fibers go to the scaphoid, the fibers they go to the lunate, the fibers they go to the triquetral. Scaphoid, lunate, and triquetral. This is palmar radiocarpal ligament. Similarly, there is palmar ulnocarpal ligament. There is the palmar ulnocarpal ligament, which starts from the ulna and goes to triquetral and the lunate bone. It goes from ulna to triquetral and lunate. This goes from radius to scaphoid, lunate, and triquetral. Then the fourth is dorsal. On the dorsal side, there is only the radiocarpal ligament. There is only radiocarpal ligament, which again goes from radius to scaphoid, lunate, and triquetral. The fifth ligament is radial collateral ligament. Radial collateral ligament, which starts from radius, and so this is the radial collateral ligament. Radial collateral ligament. This starts from radius and goes to scaphoid. And on the lateral side, there is ulnar collateral ligament. It starts from the ulna and goes to the triquetral. and also to pisiform. So these are the ligaments. The capsule, which is attached to the proximal row of the carpals and lower end of radius and ulna. Palmar radiocarpal going from radius to scaphoid lunate triquetral. Ulno radiocarpal going to triquetral and lunate. Then dorsal radiocarpal going from radius to scaphoid lunate and triquetral, and radial collateral ligament going from radius to scaphoid. Ulnar collateral ligament going from the ulna to the triquetral and pisiform bone. Okay, so that is about the ligament. Now we move on to the next part of the description of the wrist joint, and that is we are now going to talk about the relations. Okay, relations very easy, and on the anterior side there will be long flexor tendons, and of course on the posterior side there will be the extensor tendons. Here, along with the long flexor tendons, there will be median nerve on the anterior side. So in the arthritis of the wrist joint, the median nerve will be affected. There will be extensor tendons posterior. Okay, laterally there will be radial artery. These are the relations of the wrist joint. The blood supply. Blood supply comes from anterior and posterior carpal arches. Carpal arterial arches. Okay, carpal arches. Carpal arches. That's how the blood supply comes. The nerve supply is very easy to remember: anterior and posterior interosseous nerve. Anterior interosseous nerve and posterior interosseous nerve. Okay. Now let's talk about the movements. Movements at the wrist joint. The wrist joint is biaxial, so one axis will be transverse. Around this transverse axis, two movements will take place. One is flexion, another is extension. Another axis is vertical, is anteroposterior. Along this anteroposterior axis, two movements will take place. One is adduction and second is abduction. Okay. So movement we always describe as the movement. Then we talk about the axis, and then we talk about the muscles producing the movement. Okay. So flexion will be taking place around the transverse axis. On the transverse axis, and the muscles causing flexion will be flexor carpi radialis, flexor carpi ulnaris. Okay, and along with that there is one more muscle which is not exactly the other muscles. The other muscles will be flexor digitorum longus, flexor digitorum profundus, flexor pollicis longus, and abductor pollicis longus. Abductor pollicis longus also. So that is about flexion. Extension will also take place around the transverse axis. Around the transverse axis, and extension will be caused by extensor carpi radialis longus and brevis, extensor carpi ulnaris, extensor digitorum, extensor indicis, extensor digiti minor. Now let's talk about the two other moments, and that is adduction. Adduction takes place around antero-posterior axis, and the muscles producing it will be all ulnaris, flexor carpi ulnaris and extensor carpi ulnaris. They will be causing the adduction movement. While abduction movement at the wrist joint, again antero-posterior axis, and it will be caused by radialis. Okay, so it will be the flexor carpi radialis, extensor carpi radialis longus and brevis. Longus and brevis. The abduction will be also caused by abductor pollicis longus. Okay. Then there is a moment of circumduction, which is a combination of flexion, extension, adduction, abduction. So we don't consider it as a multi-axial joint. Coming to the last component of the wrist joint, and that is the clinical anatomy. Clinical anatomy of the wrist joint. So wrist joint is a common. It is very commonly affected in rheumatoid arthritis. Rheumatoid arthritis. So now when it is at, therefore rheumatoid people have problem with the wrist joint, and then the median also is affected. Ganglion, very commonly seen ganglion is a swelling, which is cystic swelling, because of the mucoid degeneration of the synovial sheets. The synovial sheets of these tendons which are there on the backside, they undergo degeneration, and we see a swelling called as ganglion on the backside. The optimum angle with on which the wrist joint can be fixed. Suppose there is lot of pain in the wrist joint, so we fix it at 30 degrees, because in that angle we eat, that angle we right. So that is the optimum position of the wrist joint. Okay, thank you so much.